Hello, good evening, and welcome to the official book launch of Wide Awake in a Dream by Rosaline Daisy. My name is Alison J, and I will be your host for this evening. Today, we're going to speak about Rosaline's book and why it is important. Rosaline went through a major health trauma and survived against all odds. Now, you may say, so many people do every single day. Why is this different? Why is she so different? What makes this situation different? And you would be quite right, because yes, every single day, people go through trauma, people go through strokes of all kinds, people go through so many different challenges, but Rosaline's journey is a journey of survival. It is a battle when everything and everyone wrote her off, everything was stacked against her. As a Black woman, she was faced with a devastating stroke and a tumor, which could have been malignant. She had to fight to be heard and be taken seriously. She had to fight to retain her health and her psychological health. She had to fight to maintain her sanity at a time when she felt as though she had to cast her needs to one side and consider those of everyone else around her. She had to fight to keep hold of her children, her home, as a result of being going through so many challenges on so many levels. Rosaline had to come to terms with the loss of who she was, her former self, the near loss of her sanity, as those challenges do take a toll on your mental health, the near loss of her children and her home, the loss of some of her relatives, the loss of her status in society, and the loss of her career, her marriage, and she even lost her father to cancer. So without any further ado, I will introduce the author herself and our esteemed panel of guests. We have Rosaline Daisy, the author of Wide Awake in a Dream. We have Dr. Richard Greenwood. He is a consultant neurologist at Homerton Hospital, where Rosaline was actually hospitalized. We have Patricia Lamore. She is a gender champion and education specialist, the CEO of Aspire Education. And last but definitely not least, we have David Weaver. David is the president of the British Association for Counselling and Psychotherapy. So I would just like to welcome all of our guests to the official book launch for Wide Awake in a Dream. And so just to give you a little synopsis of the book, as we were mentioning earlier, Rosaline had to fight through so many things, and she had to fight to be heard. And many times we're looking at things and we just automatically take the words of the doctors and the specialists for granted. But without the drive, without the determination that Rosaline had, the silent crying inside, Rosaline may not have been with us today in the picture of health that she is. And in this time of pandemic and a decline in society's mental health and physical health, there is no better time than right now to talk about such health issues as trauma, as stroke, as tumors, as Rosaline had gone through, and its overall effects. So I would like to first bring on our first guest, Dr. Greenwood. Hello, Dr. Greenwood. How are you?
Hi there. Very well, thank you.
Good, good. Oh, thank you so much for joining us. We do appreciate it. And I'm just going to jump straight in, Dr. Greenwood, and just ask you, strokes. What is a stroke exactly, and what causes a stroke?
Well, it's called a stroke because it happens at a stroke, usually. and you can have a stroke from a blockage of a blood vessel or a burst of a blood vessel. So it's a disorder caused by a problem with the blood vessels that supply the brain, either due to a blockage, which is what Daisy had, or due to a burst blood vessel.
Okay. And with so many other diseases and illnesses, there is often a fallacy that things are hereditary. So could strokes be hereditary?
They can be, but not in Daisy's case.
Okay. So in the cases where they are hereditary, what kinds of things could be the symptoms and the triggers for that? What could people look out for to prevent it?
Well, the fact that they're hereditary doesn't change the symptoms with which the stroke presents compared with people who have strokes which aren't hereditary, because the symptoms are driven by the effect on the brain that the blockage or the burst, the bleed have on the brain.
Okay. So with that being the case, and it's a blockage and things like that, so is there any way that a stroke could be prevented? So, for example, a change in diet and lifestyle.
So there are what's called risk factors for stroke, which are things like smoking, diabetes, abnormal cholesterol in the blood, various other things that make the blood clot easily. One of which recently it's been realized is COVID infection. So the treatments for blockages are focused on preventing the clotting that happens within the blood vessel.
Okay, thank you for that. So another question then. So if you have somebody that has had a history of blood clots, for example, I know that there's an illness called antiphospholipid syndrome and things like that. Could that make somebody at high risk for having a stroke?
Certainly at risk, yeah.
Okay, so thank you.
Many, for example, a high percentage of people who have a stroke as a result of COVID are found to have antiphospholipid antibody in the blood. So that makes the blood a bit more sticky anyway, and the COVID makes it even stickier. So you can see how stroke blockages, the blockage type of stroke may happen in COVID.
Right. Okay. Thank you. That's very helpful because I do know of people that have been diagnosed with phospholipid syndrome. So that's very helpful and useful information. And just in case anybody doesn't know what antiphospholipid syndrome is, it's a blood disorder that makes your blood more predisposed to clotting than the regular person. Is that correct, Dr. Greenwood?
That's right. So the treatment is to thin the blood. But if you've got antiphospholipid antibody syndrome.
Okay. And so with regards to that, so can you talk to us about what are the physical and mental effects of a stroke?
So to understand the effects of the stroke, you need to understand a bit about how the brain works. So if you have a stroke in the left side of the brain, because most people are right-handed and therefore have their language organized in the left side of the brain, it's very common to have a problem with language if you have a left-sided stroke. If you have a right stroke in the right side of the brain in a right-handed person, then you have problems with what's called spatial orientation, which means understanding where your body is in space, that you've actually got a left side, and that obviously affects all sorts of ways in which you get around. And in addition to those effects with language on the left side and visuospatial orientation in the right side, you also get with the strokes affecting the left side of the brain, producing a right-sided weakness of the arm and leg, and often numbness and pins and needles down the right side. And with a stroke in the right side of the brain, then you get a left-sided weakness and sensory symptoms.
Okay. And so with regards to those physical effects, and I suppose, and if you can correct me if I'm wrong, depending on the severity of the stroke, does that depend on the severity of the physical disabilities that the person that has suffered the stroke then has to overcome and get treatment for?
Yes, the larger the area of damage, the more severe the problem in the visible problem is, and the more difficult it is to reverse those effects, and the more residual problem you have long term.
Okay, so that's the physical effects of a stroke. What does it do to a person mentally?
So it depends what you mean by mentally. If you're talking about thinking, then the left-sided strokes affect thinking, particularly associated with verbal information. So you can't put a sentence together, you can't think of words, you don't understand what people are saying. And likewise, you're reading, if you can't understand what people say, you can't understand what a book's trying to tell you. So your reading becomes difficult. If you have a stroke on the right side of the brain, then you have problems with insight, particularly to do with what your left side is doing and what's in the left side of your external space, if that makes sense. So you may neglect things on the left side of external space, and you may, for example, bump into somebody on your left side when you're walking down the street, not realizing they're there.
Right.
In addition to those sorts of problems, you get problems with more generalized brain thinking problems to do with attention, concentration, processing information, making judgments. So you may not, to the extent that you may not have the ability to manage your finances or your relationships, and your personality may change so that your relationships become a problem. And if you don't get better, then that may lead to breakdown in relationships and families, which may create huge problems on a wider scale than just influencing the patient who's had a stroke.
Of course, yes, because if it breaks down the family structure and unit, then for most people or a lot of people, that could actually also mean the breakdown of their support system as well.
That's right. Yeah. So support is one of the crucial things to improvement long term when people have left hospital.
And that is very important. So thank you for mentioning that, because there's many times, I suppose, because a person is strong-willed, those around them, they either don't know how to give that support, or the person that has suffered the stroke may push them away. So it's important to know that regardless, that person really does need a solid support network in their healing and rehabilitation process.
And their social network needs to understand what has gone wrong and why it's gone wrong, so that they can help the person despite the person being angry or silent or depressed.
Because it more than likely is just that person not directing it personally at their social or support network. It could be more a frustration within them that's, as we mentioned earlier, that's the loss of who their former self, who they were, and trying to get that back.
So in other words, there's what's called social behavior is changed. And that's a very, very difficult thing for their support system to help, particularly if they don't understand what's happened.
That is interesting. Thank you. Because so many times we don't think about the effect, that the wider effect it has on the support system, the family, the social network. We just look at the person that has gone through the trauma of suffering a stroke and what they need, not realizing that sometimes what they need is that support network. It's not necessarily they need the medical attention, but they also need they need some sort of normalcy, for want of a better word, as well. Would you not agree?
Yeah, they need their support system to have been through what's called brain injury education. So the support system understands the problems that may arise with social interaction, the reasons why the person can't get back to work or can only get back to part-time work, so that they can prevent them doing things at work that result in them being sacked, and so that they go back to the right sort of role at work, for example. So it's not just teaching trying to teach the patient, but it's also important to teach their support system, whatever that might be.
Yes,
and those things are become more and more important in the longer term. Most of the medical treatment finishes early on, and you take tablets to stop another stroke. You can't make the scar better, but you can learn how to handle the consequences of the scar.
I like how you put that. Thank you. So, can you describe the general rehabilitation process for a person that has suffered a stroke?
So broadly speaking, it's like a training program. Whether you're trying to run the 100 meters at the Olympics or whether you're trying to get over the consequences of a stroke, the principles of rehabilitation are largely the principles of training. And that's in order to use the normal brain as much as possible and stop avoidable problems happening. So if you have a stroke, you go home, you're not motivated, you're depressed, you sit in front of the telly, don't do anything, you'll just become more immobile. So that, whereas if you have therapists coming along who know what they're about, they can encourage you to do things.
Right.
And everybody knows that it's helpful to have a trainer. And if you have had a stroke, those trainers, as it were, are called speech and language therapists or neurophysiotherapists or occupational therapists or clinical neuropsychologists to train the the patient to practice things that make their particular difficulty improve. So you can see how it's a very difficult process to deliver properly, and it's a very difficult process to undertake properly, because as we all know, if we train intensively to pass an exam, let's say, you only manage to do it if you're motivated to do it, and motivation is derived from brain function. And if you've had a stroke, brain function is not normal, so your motivation is not normal very often.
And can I just ask you, so a lot of the therapies and the treatments that a person would they need to go and go and seek out those specialists themselves, or is that something that is part of the treatment that is done through either their doctor or the hospital?
So immediately after a stroke, after you've had the acute medical treatment of one sort or another, then you move into inpatient rehabilitation with inpatient therapists. And then at some point you'll be discharged to the community, where you have rehabilitation in the community, which is much less intensive.
Okay. Thank you. And can I just ask, from your experience, have you noticed any differences in recovery rates between men and women?
No, it's more to do with the size of the severity, the size of the extent of the damage, where the damage is in the brain, what other things other than movement have been affected. There's not a particular prognostic difference in men compared with women.
Okay, that's interesting, because there's in so many different instances in throughout life, we do hear that recovery rates sometimes do differ. So I just wanted to ask that question, because I know there's many people that have wondered that. So my final question to you, Dr. Greenwood, is I know that we have asked you how strokes occur and can they be prevented, but my final question to you is, other than changing your diet and your lifestyle, is there any advice that you can actually give to somebody that, for example, may have a high history of strokes in their family, or somebody that might be concerned about having a stroke? Is there any advice you can give to that person about how they could possibly prevent having a stroke?
So if you've got a family history of stroke, you need to find out what the particular risk factor is that runs in the family. Is it diabetes? Is it a clotting abnormality? Is it some abnormal blood problem with abnormal blood vessels? All these things may run in families, and once you've identified which of those abnormalities is the risk factor, then you can focus on treating that particular risk factor. Hypertension, blood pressure is another example. Sorry, what was your second question?
It was just really what advice you could give to anybody that has had a history of it in their family, if they're concerned themselves that they could be on that path to having a stroke.
Yeah, so that's what they need to get their GP to find out, what particular thing runs in the family in terms of the underlying factor that causes the stroke. Is it blood pressure, diabetes, etc., etc.?
Okay, so basically it's just really good for us to know our family medical history, so that can help us further down the line.
Yeah.
Thank you so much. Dr. Greenwood, I'd just like to thank you for taking the time to be with us today, to answer our questions and just to help give us some information and education on strokes. Thank you so much, Dr. Greenwood.
Pleasure, nice to talk to you.
And you, thank you. Have a good evening.
Thank you. Bye-bye.
Thanks, bye-bye. Welcome back. Thank you so much. I just want to thank Dr. Greenwood on behalf of the panel and Rosaline for joining us today. And without any further ado, I would actually like to introduce to you Rosaline Daisy, the author of Wide Awake in a Dream. She's going to be reading an extract from her book.
Good evening, everyone. Thank you all for joining us here this evening. So, Wide Awake in a Dream. This extract comes from chapter 2, The Bounce Back, the realization of what happened. Bang, that was it. The thought of my children. Nathaniel, 18 months, Stephen, 17, and Ethan 6 years old. My babies, it needed me. It was like a sledgehammer that hit me on my head. Inner voices said to me, straighten up, man up, come on, somehow you've got to get over this. Your children depend on you. Even though I had that epiphany, my head and heart were in turmoil. Part of the time, I was feeling numb. I think I was in shock, then angry, confused, sad and depressed. And all the while, there was no one I could speak to. Was this what life had become? No. I had more life to live, don't I? Or is this it? In between the descending feelings of doom and gloom, my speech came back. I don't think it ever left me. I just chose not to speak to anyone. Part of the depression, I guess. I struggled first to eat, which was a little difficult, but soon it was okay. The left side of my face had dropped, and for a while my tongue felt strange, but my tongue recovered quickly, as most would tell you. When I was ready, I was very vocal, asking questions, requesting help from the nurses, and asking to do extra physiotherapy. I was eating soft foods and taking liquids. I hated looking at myself in the mirror. That was not me. And when my immediate family looked at me, I could see on their face what they saw, and that made me feel worse.
Thank you, Rosaline. Thank you for sharing that with us. That's very, very powerful, what you have just read. And I would just encourage everybody, please get the book Wide Awake in a Dream. It's available on Amazon. Reach out to Rosaline online on her website, rosalinedaisy.com, if you have any questions. And now I would like to introduce Patricia Lamour. Patricia is a gender champion and educational specialist and the CEO of Aspire Education.
Hi.
Hello, Patricia. How are you?
Hi, I'm fine, thank you. Let me sit myself in the middle so that I don't move around. Hi, Rosaline.
Hi,
Lovely
Pat.
to be here. As you know, I'm here really. I put my hand up not because I've read the whole book, but because I know the author, and that's why I'm here. And I think the story that she has to say is really an important one for all women, you know, and particularly Black women. It was really informative listening to the doctor at the beginning, because then we have an account of really what Rosaline had to go through. And the fact that she's with us today, speaking clearly, brain completely on the ball, to be able to actually have written a book about her story, just shows you the amazing resilience and recovery of Rosaline. So, you know, I'm really, really chuffed. I was thinking as I was listening to Dr. Greenwood, did any of your family have any, what did you call it? Let me see what it was called. Brain injury education. Was that ever offered to any of your support system?
I don't think so at the time.
Yeah.
But it might have been, and I might not have been aware of it.
Yeah, but you know, it sounded to me, I thought, I wonder if that is, because unless you know, or unless we know what is actually available for everybody, then we can't actually demand or ask it. So I'm sure that would have been really helpful for your husband and your family to understand all the kinds of things, because I found it really, really informative. And the other thing that Rosaline said about she chose not to speak. And then when you were ready, you know, a lot of it was coming out. That must have been, you know, and not wanting to see yourself in the mirror. I mean, what I'd be really interested to hear from Rosaline, what helped you to overcome that and to, you know, really see yourself in the mirror? What is it you think?
I don't know if I can still look at myself in the mirror.
Oh, you're beautiful. Come on, Rosaline.
No,
You're
I mean,
beautiful.
it's taken a long while. I think because when you go through something like that, you lose all confidence. And when you haven't got people around you that's supporting you in the way that you need to be supported, where do you get that confidence from? So I think for me, I just had to push myself one step at a time and challenge myself in different ways until I felt confident enough to look in the mirror again, so to speak. Like just going out, going to the shops, just doing things on my own, facing people and accepting when people wanted to help me, because that is something I wouldn't accept normally previously. But then when someone wants to open a door for you, say, oh, do you need some help? It's like, oh yes, actually I do need some help. And just sort of learning to love myself again and just accept the new me. So that took time.
Yeah. I mean, something that I remember reading in the book and actually discussing with you about it, that as a woman and as a mother, you know, the first thing you were thinking about to help you on your road of recovery was that you were needed, that your children needed you. Just to share with you, I'm a recovered from a critical illness twice. I'm a survivor of breast cancer twice. And I remember the first time when I found out the diagnosis and I was in hospital and had the first surgery, I had to go back under again for the second surgery as well within 2 weeks. But the first time I remember I was sort of, it's like a checkbox exercise. I said, okay, I was going through the children and where they were in their life and what I think had happened. You know, I think my husband at the time had got his doctorate, so that had been done. I'd supported him to do that. My other daughter, she was old enough, my son, and I was going through the list and I was sort of saying, okay, I can go now. I remember my first reaction was about going, but I think that was different for you, Rosaline. You were fighting from the beginning.
Yes.
Yeah?
Well, my youngest was only 18 months. So I have 3 sons. The eldest was 17, just finishing his A-levels. The middle son was only 6 years old, and my sensitive son, he's my sensitive child. So I knew he couldn't cope with it. And my last son was only 18 months old. I hadn't got him out of nappies yet. I hadn't potty trained him or, you know, so there was still work for me to do. I needed to be there. So I couldn't tick anybody off.
Exactly. No,
And
but
No, go ahead. So I'm sorry.
Okay. No. So I think, you know, as a mother, what pulls you back to reality and to get you functioning is that you have children who depend on you. I know that also helped me. But I think one of the things that, because I, you know, what I know of you, Rosaline, in the time that I've seen you as a amazing, you know, professional in the mental health sphere, as someone who's very conscious about the situation of Black people, of Caribbean people in this country. I think the connection that you have and your consciousness to your family and to your heritage, I think that has played some part in your will and determination to pull through. I don't know if I got that wrong.
No, I think you're right, because I come from a long line of women in the Caribbean that were very strong, from my knowledge of them, very strong, from my grandmother, my grandmother's sisters, all of them, all the stories I've heard over the years. So, and naturally, my own mother is very strong. She actually was a tomboy in St. Lucia growing up. So she's only a 4 foot Indian woman, very slight. So, you know, I inherited a lot from them, and that helped me. So I always felt I had to be strong. And as a result of that, everybody around me expected me to be strong. And I've always been the strong one in the family, helping and supporting and doing whatever was needed to be done. Even when my dad retired to the Caribbean, he knew if he needed anything, he could ask me and it would be there. Or if he needed something being done, I could do it. I was the one that could be relied upon. So, yeah, definitely from a Caribbean perspective in my family.
Yeah. And Patricia, let me just ask you something, because it's interesting that you said that as you were going through your illness, you checked off the list and says, that's it, I can go now. And it's interesting that you should say that, because from what I know of you, you are a gender champion. You are a survivor yourself of a life-threatening illness. You were the caregiver, the primary caregiver to your mother before she passed a few short months ago. You were also there long distance for your ex-husband before he passed. I think it was about a year or two ago now. And a mother of 5. So although your illness was different to Rosaline's, what really touches you and resonates with you most about Rosaline's story that speaks to you and other Black women and other women who have overcome a stroke, that would make it different? So you're looking at her saying, okay, I couldn't say I'm ready, I can go now. But whereas you were like, okay, this has been done, I can go now. I mean, what really resonates with you that you would encourage somebody to say, hold on, keep fighting?
Well, that was my initial reaction, about I can go now. I suppose it's part of my kind of like my Buddhist nature about acceptance, because a lot of the fight that we have in this life is when we don't accept things as they are, and we try and we run away from it. And because I knew that this was, thankfully the cancer that I had wasn't one of the most dire. I mean, for instance, my sister got cancer after me and she died before me. So, so I did sort of do my homework to find out about the severity of the cancer, and I actually caught it earlier. But I think one of the things that's important for women, and Rosaline was showing that, is that you're relied upon. You've got to be strong for so many other people. And I think one of the key things that we have to learn to do as Black women who are carers and who are strong is to say no to others so we can say yes to ourselves.
That's good.
Yeah. Say no to others so we can say yes to ourselves, so that we create the space. It's like, it's only when we've done this, and this, can we sit down and relax. Only when that, and that is done, can we, take time out to pamper ourselves, etc. Mm-hmm. And I think one of the things that my illness, and also I suspect also Rosaline, in terms, because she talks about in her book about the physiotherapy, asking for more physiotherapy. She's even doing yoga now, going to the gym, things that, the training, the ongoing training, in order to create that space for yourself. Mm-hmm. You have to let go of other people, because other people, men, children, colleagues, activists in the field, they will latch on to your energy. They will expect you to do. And, almost it's like as if you feel guilty when you say no. Mm-hmm. And I think one of the first things that we have to learn is taking time for self, taking time for healing, taking time to just be is as important, if not more important, than doing everything else for someone else. And also, I had to learn that, for instance, when things hit you and you have to deal with stuff inside of yourself, we have ways of dealing with it. Like, for instance, my way, when I'm under pressure, trauma, I tend to do more. You get into that more hamster mode, you know, because you're deflecting. I've got to do this, I've got to do that, I've got to do the other. You're rushing here, there, and everywhere, and that's about how you're dealing with the pain and dealing with the discomfort of what is actually happening to you. And I remember once, several times, I've just like stopped. Just stopped. Let it go. Sometimes your body, that's what your body's trying to do. You know, when it licks you down, you know, as you said, like a stroke, or your fatigue, your intense fatigue of your body, while your body is trying its best to look after you and look after itself and to heal. You have to take time to just be and to heal and recover. And I think we don't do that enough as Black women. And that's why I think it's so serious what has to happen to us. It's almost as if life sort of says, so if you can't hear, you must feel. Yeah.
It's taken me a long time to learn that.
And it's so true, because when you think about it, our bodies are always talking to us. Our bodies are always talking. The thing is, we are not listening and we are not paying attention to what our bodies are saying. And unfortunately, for so many, the only time we do stop and listen is not really because we actually stopped and listened. It's because our bodies made us stop and listen. Because in your case, Rosaline, a stroke. Patricia, in your case, you went through 2 bouts of having treatment for cancer. And I can say, like, for in my case, when I was asking about the antiphospholipid syndrome, that was actually me. I was diagnosed with that. So that's why when he mentioned about the clots and your blood being sticky, I'm thinking, hold on a second. So it makes you have to listen.
Hold on.
And that's something that really, as women and as Black women, we, as you said, Patricia, we don't do merely enough.
So if there's one takeaway that women listening in today, say no to others so you can say yes to yourself. It's key.
That's a great quote.
That is powerful, Patricia. Thank you. And Patricia, I'd just like to ask you one more question, because I want to get back to Rosaline so she could read us another extract from her book. So I would like to hear your thoughts relating to Rosaline's strength to overcome the disabling illness and the trauma, her courage and her determination to rise above, to be not just seen, but to also to be heard and to now lead.
Exactly. I think it must be from her upbringing. I think the way her parents brought her up. I mean, I had a discussion with Rosaline. I'll share a bit. You know, she was an active netballer. Yeah, like her sons are active sports people. And of course, you know, when you're really good, you're going to tournaments here, there, and everywhere. Now, unlike today's parents, where we're chauffeurs to our children, driving them up and down, here and there, whatever. In our day, and it's same with me, her dad used to say to her, don't bother calling me to come and pick you up. You know, if you find yourself in Birmingham, don't expect me to come and get to Birmingham to come and bring you back. Now that exactly, find your way, find it. And I think it's that kind of tough love that parents of our generation meted out on the children. You know, like if you want something, you have to find a way. You know, you're afraid to ask your parents for new this, new that, get even pocket money. You know, something which is seen as a right by many of our children. You know. What? Pocket what?
Pocket what?
Exactly. So I think the upbringing, number one, definitely. And then secondly, her own work on herself and her accomplishments as a woman, as a professional. You know, she studied to the highest level. she was accomplished in her various professional endeavors in the criminal justice system and now in the mental health system, so that she had actualized herself, so she can see that she can do. So upbringing plus that, and also the work that she was doing concerned about her community. I think that's for me as well. For instance, when you are linked into something that is bigger than yourself, bigger than your family, that actually links to your whole people, a sense of peoplehood, this helps to strengthen you and give you resilience. On the other hand, it can be escape, by the way. Some people, they don't deal with their personal stuff because they're so busy doing their politics and their activism and et cetera, et cetera. And that is a way of actually escaping their own personal inadequacies. But, that aside, I think, politics and consciousness at that level helps you to find a courage and a voice to speak out about injustices that you see in your community. And then hopefully that's also taken for self, as opposed to just speaking out for others and then not doing it for self. So I think a combination of those and of course a supportive network of friends and fellow travelers in that journey, I think, because I know she's had to overcome a relationship breakdown.
Yeah.
And that is hard. And I think also, it's because she's a woman, a Black woman. I do believe that, let me put my theory. If I was God, I would not give the survival and procreation of the species to the weaker sex. Mothers have children for a reason. So any notion that we are the weaker sex, which is passed down through patriarchy and sexism, just throw that out the window. You wouldn't give the weaker sex the responsibility of life of the whole species, whatever it is, whether it's an animal, we are part of the animal kingdom. Yeah. So I think that, and because she's a woman and the lineage of the African Caribbean woman, the DNA that runs through her veins, the history that we're able to tap into consciously or unconsciousness, I think that gives us, when we are authentic and we do tap into it, that gives us a power and a courage that doesn't just come from ourselves. And I think, we learn to draw on that. And obviously, I think last but not least, her faith. Her faith, her spiritual faith. So that's me.
Thank you, Patricia. Thank you so much for joining us. And it's been great to learn a bit more about yourself because, yes, we're talking about Rosaline's book and surviving a stroke. There are so many women out there surviving so many other things. So to see two extremely beautiful, powerful Black women having survived these things and here to support and encourage each other and share and help educate about their experiences. Gratitude, and I'm so grateful. Thank you so much, Patricia.
Thank you, Alison, and thank you, Rosaline. Congratulations.
Thank you.
Thank you. Bye-bye.
I'd like to thank Patricia Lamore for her time, for sharing and being so open with us about her experiences and her encouragement and thoughts of Rosaline's book, Wide Awake in a Dream. And now I would like to turn over to Rosaline, who is going to read to us another extract from her book.
Wide Awake in a Dream, Chapter 8. Have you ever mourned your own death? I'll say that again. Have you ever mourned your own death? Sorry, I can't read with my glasses on. No one sees you or hears you screaming, but you know you are screaming. This brings to mind the film Alien. In space, no one can hear you scream. That's what it felt like. That type of pain is excruciating and unbearable. It physically manifested in me in constant crying. I remember being really tearful with some visitors, the ward priest, and the nurses. I couldn't hold it in, and no one could contain me. However, I had to be strong in front of my children and parents. I couldn't let them see me like that. It would do them more harm than good. This continued on and off over a long period of time. I felt guilty that I had done this to my children, even though I knew I had no control over what was happening to me. I still felt bad at putting them through this. It wasn't fair. They shouldn't have to experience this, the fear of possibly losing their mother. How was this going to affect them in the long term? How could I cause my parents so much grief and heartache? I felt responsible for them.
That is powerful stuff, Rosaline. Thank you. Especially the part where you said that in space, no one can hear you scream. Because I'm sure some people probably can't be able to fathom what that is like. And there are other people that are listening, nodding their heads passionately, yes, that's it. Because there's so many times people go through things, and until you hear somebody else say something, you think, those are the words I was looking for. And I think you have spoken for so many right now in saying that in space, no one can hear you scream, that silent inner screaming that you are going through because of the trauma that you had just experienced, where you had to relearn to do so many things because you had lost your former self, the vivacious person that you was. Thank you for sharing that. And now I would like to bring on with us David Weaver. David is the president of the British Association for Counselling and Psychotherapy. Hello, David. How are you?
I'm good. Really pleased to be here.
Thank you so much for joining us.
Good. Really pleased to be here, and it's an honor. And I had the fortune of being able to speak to Rosaline quite a lot during this period. And I think one thing I would say is that it's still a journey. Mm-hmm. You know, Rosaline has been very courageous in talking to others about what she's experienced. And there is that link, as the doctor has said and Patricia has said, between physical health and mental health. And sometimes the mental health aspect of it is the most difficult piece. And I think that what Rosaline is giving in her book, and everybody should read this book, they're lessons to people who are going through this process. So you read that, and just listening to what Rosaline is saying is inspiring for people who find themselves physically ill. It's lessons for the NHS, because what you'll find is that she'll speak about the NHS, she'll speak about the treatment she got from nurses and doctors. There's something about government, because there aren't enough people that look like us. There aren't enough people that look like Rosaline in the system. And so even where they may have tried to help, there was a big gap between what they knew and what they actually did in terms of Rosaline being a Black woman. So there's a lot of lessons to be learned for people. And if you just think about what Rosaline is saying, is that, you know, how do you reconcile losing your former self? You know, so you're going through a process and you have realized, actually, I am not going to be me anymore. And Rosaline was working on herself, and all of a sudden, bang, I think you use that term, bang, in an instant, that's changed. How do you deal with that? How can you operate and cope when everyone around you is either is not supportive either institutionally, because when you're in that system, you're there institutionally, whether they want to as individuals or not, you're not being supported. And it's an impact on you if you're a Black woman in different ways than if you're white. And you're not supported sometimes by your family and friends because they just don't know what to do. They don't know what to say. You don't know how to relate to them. So even the very people that are closest to you will often say things that have the most negative impact unintentionally. There's still a stigma around seeking help. And even if you wanted to seek help from the counselling professions, which is where I'm from, you're not getting that because there aren't enough Black counsellors there. So when the doctor spoke about the internal therapeutic care that you get, which is intensive, and then you go out there, there's nobody there. Proportionally, you're not going to get someone that you need to speak to. So there's a message that Rosaline is giving politically. So this has to go out, and people will use the term brave and courageous, but Rosaline, you've really done that. This has to go out because it has lessons for everybody. And I think there's something particular about Black women in the system as well, because you know that Black women have the highest risk of death during childbirth, almost 5 times greater than white women, in fact, over 5 times greater than for white women. And some of the reasons behind that is due to some of our strengths. So there's that stereotypical thing about we're strong. The Black woman is strong. You can deal with the pain. You can deal with the pain, And if you look through this book, and Rosaline and I haven't spoken about this, I think there's perceptions around that. Black woman, she's strong. She can deal with the pain. That impacts in terms of diagnosis in the first place. We can cope through this. And our Black men aren't supporting that because they think the Black woman is strong as well. So there's something around Black men. How are we supporting? How are we ensuring that, we're doing the early diagnosis if this institution isn't doing the diagnosis? So I'll just say that just to throw that out and ask me some questions. But the whole thing around mental health is really, really supportive. If you don't get support, if you're not getting support, just like the doctor said, you're not going to recover. There's a big link between mental health support and recovery.
And thank you. And I'm glad you mentioned that. And you spoke about the disconnect between the medical profession and how Black women, Black people are treated in general. Because I was having a conversation about a month or so ago with a Black lady who is there in the UK. She has gone through a different illness. And she was talking about, she mentioned the exact same things that you did, David, and she doesn't work in counseling and psychotherapy. She is just a Black woman having gone through medical treatment. And she was talking about the exact same thing, the stereotype of Black women, they don't feel pain. So therefore, they don't get the same treatment as white women. So it's very interesting and alarming at the same time that in so many different areas, from so many different walks of life, that people are recognizing this, but yet still the medical profession are doing nothing.
And the medical profession recognize it. How can you have something as stark as 5 times more likely than a white woman for your child to die during childbirth? So the medical profession knows this. It's a political point. And this book, as well as I keep saying, as well as talking about the personal stuff, is making a political point, because we can't address recovery unless we start addressing the issue of culturally appropriate support medically and culturally appropriate support in terms of the mental health and counseling, because counseling saves lives. Now, there are entities out there that are Black run, the Association of Black Psychologists. You've got the British Association of African and Asian Therapists, and there are other networks around, but this should be institutionalized. When you find yourself in a situation like Rosaline, it shouldn't be on the behest of, and I'm not trying to talk too much about the detail of your book, Rosaline, but there were individuals that were supportive. There were individuals, in a sense, that actually helped through conversations that they had because they were good. Why should you have to relate to rely on the luck of the draw? It's like the lottery, that you will find someone walking around that has your interest in mind knows how to relate to you either culturally or in terms of you as a Black woman or whatever, rather than the institution doing that. So it's a political point as well.
That is a very interesting point, and I'm glad that you made that, David. As you said, not to give away too much that's in the book, Rosaline, because we do want people to buy it and read it. But that is something that is so important that people do need to know. So, David, thank you. But I just want to switch it over now and speak about the counseling and the psychotherapy aspect of going through a trauma, such as in Rosaline's case, a stroke. So, David, can you talk to us a bit about the mental side of things? So, looking at depression, first and foremost, what is depression? Because depression, people using the word depressed nowadays, it reminds me a bit of people using the word love. Oh, I love apples. I love this. I love that. In some cases, I think it's a bit overused to the point where the significance of it now is downplayed. I mean, what are your thoughts on that?
You're absolutely right. And people use the term depression, anxiety, I'm just stressed out interchangeably. And they're not the same. So what I would say about depression is where there's an impact on the very essence of your ability to actually make sense of what is going on. And with the lack of support and therapeutic intervention, and it could be clinical, but it could be through the lack of support and so forth, not being able to make sense of what is going on. And then that puts you into a spiral of a sense of despair. I don't know what to do. I can't cope with this. I can't make any sense of this. And what then happens is that becomes internalized into a point where actually you just cannot cope. And that's where therapeutic support is really required. So you can make sense of your surrounding, you can make sense of what is going on for you in your mind and make progress and come out of that particular state. So it's more than just anxiety. It can reach a point where you just don't know what to do. You just can't live your life. And there's a constant feeling of just feeling down. And that has disproportionate impacts on Black women. And because there is a link between depression and anxiety and race and racism and mental health, because racism makes you mad. You know, racism has an impact on your mental health. Racism would have been a factor in relation to Rosaline and her feeling of anxiety and her feeling of depression and her ability to get out of that because of a lack of appropriate support. But that depression piece is a really serious issue.
Yes, it is. And I'm glad that you mentioned that the way people use depression, anxiety interchangeably, because it's one of those things where, because of that, I just feel that people that really genuinely are suffering from depression and anxiety are not really taking it that serious. It's almost like they're told to snap out of it. Like you can literally just snap out of it. And I'm glad again that you mentioned the point of it's a continuing. It's not something where, okay, you're just feeling a bit down for a couple of days and then you're okay to continue. Is it really a case of people that are feeling down, like they can't function, like they can't go on, and it's something that is continuing?
So you can have people who, you know, on the surface will be performing their jobs well. On the surface will appear very, very confident. They're deemed to be successful. I can remember someone, Alistair Campbell, who was Tony Blair's right-hand man. You look at Alistair Campbell, who will talk, he will appear successful. He was inspirational to many people, and he knew what to do. He knew what he was doing, and he will tell you that there's that feeling of anxiety, loneliness, just a low feeling, a dull feeling, which can't be explained, which is a continuum. It's ever present, and sometimes it will feature significantly, and other times it will just be there. It's just an omnipresent, just present all of the time.
Thank you for clarifying that. And something that you mentioned earlier, and it seems to be a recurring theme, which Dr. Greenwood mentioned it, Patricia mentioned it, and now you have mentioned about having that support support network. So in Rosaline's case, while she was going through that, she went through the breakdown of her marriage. Can disappointment of someone that you thought would be your support system leaving, can that be something that would trigger and that could trigger depression?
That's one of the biggest impacts, where let's say Rosalind wasn't in that situation, or any of us not in that situation, we can be just depressed by the fact that the very people that we feel would be supporting us aren't there. So just imagine going through a situation like this, and for whatever reason you feel that you can't even speak to the people around you who you feel you should be able to speak to, or they may not even know what to say. And the impact of that has that impact on you, where you just feel, well, helpless. There's nobody around you. And remember, not everybody has families. And so in a sense, Rosaline has some possibilities because there was family there. So I'm not rating having a family or not having a family differently, but many people don't have families. So you go through situations like this, there's no family around. And so the loneliness piece hits in as well. We have many older people in our communities suffering from dementia. My mother has dementia, and I can see firsthand the importance of the support she gets from family. Were she not to get that, the impact would be severe. So there's something around, well, what are we doing as communities then in the absence of the institutions supporting us? And we know that, and we have to fight that. What are we doing as communities? Community organizations that were able to do this have been cut over the years. There's no chance that we're going to get that back. So the organization Black Socks, which is about do for self, is really important. That philosophy about doing for self, our churches, our faith institutions and so forth used to do that back in the 70s and 80s. But we've got to do something around that, because if our older people aren't getting the support, if people like Rosaline find themselves in the situations like they did and are not getting support, then actually there's no recovery. Because without that counseling or therapeutic, it's good to talk input, there's no recovery.
I like how you put that, David. Without that support, there is no recovery. Can you expand on just that?
It's everything we've been speaking about, isn't it? And so the doctor said it very, very clearly. And that's why in the health profession, when we're talking about health, we look at health, not just about physical health and physical recovery. We look at what we call parity of esteem between physical health and mental health, because the old way of looking at it is just looking at the physical health. What kind of medication can we give? What's the bedside manner of the doctors? How do we do the rehabilitation in terms of the physiotherapy and so forth? That will take you somewhere, but actually you've got to get that mental health support, that speaking to someone, addressing your anxieties. You can't go, you've gone through this physical piece alone. And then in Rosemary's case, Rose didn't mention this at all, anxieties about losing her children, guilt about why have I put you through this? My elderly parents have gone through that. You've got your physical thing going over there. You can give as much medication as you like, and doctor bedside manner as you like. It's not addressing the guilt issues, which there's no reason why there should be, but you need someone to speak. Not feeling beautiful anymore, losing your former self, loss of your career, loss of your relationships, the people that you want to speak to who you feel will be connecting with you. It's not happening for all kinds of reasons. So that is absolutely required. And if you're getting it and it's not culturally appropriate, if you're having a conversation with someone and they're leaning into you and they're having a conversation about, well, how do you feel? And it just seems like some Lily May from Dorset somewhere who's having a conversation with you, and it just does not make any sense, which is actually what's happening in the counselling professions. And so the work that I'm doing is around bridging that dissonance, that gap between the white middle-class female counsellor archetype and actually encouraging Black people to get into the profession through the formal, through the conventional means, but also through other means where we're looking at less Eurocentric, more African-centric therapeutic interventions to help. But I say it again, without that, there's no recovery. And that's why this is so important. That's why this book is so important. I love this book because what Rosaline has given us is a gift. She's spoken about herself, and she's still on the journey. And we should not ever forget that this continues, still on the journey. But the gift is that, and that's why we have to send it out far and wide. The gift is, this is lessons for the NHS, and Rosaline knows the system because she works in the system. And actually, that could have been even more difficult because when you're in that situation, you know what's going on around you. You're thinking, that adds to your mental health as well. But she's giving us the benefits of her knowledge of the system, in terms of the NHS, in terms of the counselling professions. She's giving that knowledge, and I'll be utilising her in relation to that. And she's also talking to us about our responsibilities. Yes, the Black woman is strong. She's the backbone of our race and everything that's gone on. She's been a backbone of that. But come on, men, let's not rely on that. Let's not rely on that. Communities. Why should Rosaline have to be strong in that situation? Let Rosaline be weak a little bit, and let the institution be strong, and let us be strong as families. And so the education of our communities and our families is really important. So the doctor talked about some basic stuff. That basic stuff that goes out in white suburban areas as community education, but it won't go out in Lambeth. It won't go out in Southwark. It won't go out in areas of Nottingham. Because why? Because we haven't got the funding to do it. So community education is really important in terms of knowledge of stroke, knowledge of diabetes, knowledge of dementia. That's really personal to me. Knowledge of dementia, because we're able to support our mother better because we know. But the system isn't doing it. In fact, older people aren't even getting the therapeutic support. Do you know why older people don't get therapeutic support? Even white older people, is because it is deemed that they're old. This is about them being older, So it's not about, so they will have physical pain.
Mm-hmm.
You will have a stroke at that age. You will have diabetes at that age. So we don't need to do anything. And we might give you the odd tablet or so, or hundreds of tablets or so, but it's not about the therapeutic support that they need. And in our communities right now, they need it for all kinds of reasons. Windrush, they're just feeling let down by our communities and so forth. It is a therapeutic talking therapy, speaking to people, that is so critical. And Rosaline's given us that gift, and we need to buy the book and spread it. And Rosaline needs to be on mainstream TV as well as this beautiful channel, telling the world and telling the country what it is that it needs to do. And I mean that.
And thank you, David. You touched on a couple of points that I just want to address. One of the things that you mentioned is the doctor's bedside manner. And it's interesting that you should say that, because having spoken to people, as I mentioned, the young lady that I spoke to that was talking about the same things you were with regards to Black women being strong. That same young lady was saying that she went to the doctor, and the way that the doctor spoke to her, it was basically to do with, she was diagnosed with adenomyosis. And she said, I cannot tell you how many times the doctor said to me, your womb is diseased. There was nothing. And this is a Black woman. And he was saying, and she's has done her research and has not found a single white woman that was spoken to that way. So
this goes back. Yeah, this is intergenerational, isn't it? This goes back to when we were enslaved, and the and white societies and the so-called slave masters view of the Black woman and her womb. And we can go into that. We could write. We could talk. We could have a chapter on that alone. But it transcends. And so when that happens, doctors need to know that there's a consequence, there's a repercussion, there's an implication if they're doing that. But if that Black woman in that space has no one to go to, and that's why organizations like Black Socks are so important, and other community organizations, and the need for more mental health provision in our communities, if they don't have anyone to go to, that's just like, I went a couple of years ago for a test because I felt that I needed something around my prostate. And we know that Black men, I think 8 times likely to have more prostate issues than white men. And I went to my doctor and I said, I just thought he would, because it was all over the place. Everyone knows that. And he says, well, no, we're not going to have that because of, and I couldn't believe it. But I because of my background and my training and my confidence, was able to tell him, you will.
Yeah.
You will refer me.
We are going to do that.
you will refer me. I mean, it's not a discussion here. This is, you will refer me. How many other people do they do that to? You know, in terms of Black communities, the disproportionalities in terms of our propensity to get certain illnesses, diabetes and posturate and heart conditions and high blood pressure and so forth. It's not just about our biological makeup. There's a link to poverty and so forth, but there's also a link to that kind of a doctor that treats us in that kind of a way. So we have to do the political thing, which again, Rosaline's book is telling us about, is we have to be challenging those kind of things. Because when we do that, we save lives. If we just complain about it, it's a great conversation. And then we have another.
But what gets done? If all we're doing is sitting around and complaining about something, what gets done? Nothing. We can't just be talking about it. And something that I says, we can't just be we can't just do it and talk about it. We actually have to be about it and do something. And David, you mentioned earlier when you were speaking about anxiety. Now, one of the questions that I wanted to ask you, because again, anxiety is another word that I just hear thrown out. I was sharing my screen with a young lady the other day and I had a lot of tabs open. She's like, oh my God, your computer's giving me anxiety. I'm like, really, sweetheart? Really? It's just another one that's just thrown out there. So anxiety, is it different from depression? I mean, are they different? And how are they different if they are?
Yeah, it is. And I'm trying to come up with a classical definition. If I could use my Google, I could just get on it quickly and tell you something classical. But I can't do that. But yeah, Rosaline, you can pick up something.
I'll give an example of anxiety. So for me, when I was recovering, when I was discharged home, I wanted to get out and practice walking, but no one would come with me. So I had to do it by myself. Now that was anxiety provoking, because remember, I don't like people looking at me. I can't even look at myself. I'm not steady on my feet. I have to use walking aids, and I have to go out there in the public, in society by myself. So even crossing a road would just put me in a panic, because I'm thinking, I can't run across this road if a car's driving down the road at speed. So to me, that was anxiety provoking. And even now, if I'm crossing a road, I have to make sure there's nothing there, or I'm at lights or something, just to feel calm about crossing a road. So for me, that's anxiety. Yeah, that's another one in relation to the hospital. Every Friday, I would go home for the weekends when I was in the rehabilitation unit. Every Friday without fail, the doctors would not get my prescription ready on time so that I could leave that hospital to go and pick up my child from nursery. Every week without fail. So you can imagine me, the anxiety me, I haven't got my baby. I want to go and get my baby. I can't get my baby because I can't leave without the medication. So that was anxiety provoking. And that's just another example of the NHS not taking patients' needs into consideration when, when working with them.
It often relates to an issue or a situation which makes you puts you into a state of anxiety, whereas depression there's a level of constancy in terms of how you're feeling and what it's doing, generally and all of the time, or on and off. But the point that you're making, Alison, is a right one, which is people just ban these words around now. Back in the day, no one would say I'm depressed. No one would say I'm feeling anxious. Now everyone is.
Anxious, right?
Absolutely. And some people are doing it to get props. So we've got to really think about it for what it is. And we've got to remember, like in COVID-19, I always say that because of the disproportionate impacts of COVID-19, it's killing our communities. We're more likely to get it as well. There is a state of anxiety and depression that's taking our communities because of our proximity to it is closer than that of white people. And the trauma which is going to emerge is 2, 3, 4 years down the line. So we've got to get some of these issues in place in terms of how we're supporting people in our communities.
Thank you for making that clear distinction, because as you said, these words are literally just thrown out there now. And I think it's really important for people to know and understand that there is a difference, and just not to take these as words to throw about, but and just realize the severity behind what you are saying, and those people that do experience anxiety and depression. And one of the things I wanted to ask you, David, as well, is suicide. Now, in your professional opinion, what is there that we can do? Is there anything we can do to support people going through such serious illnesses and trauma, that from either trying to take their lives, or in some cases, we've heard of people wanting to be euthanized?
So the issue of suicide and people taking their lives is a big one now.
Mm-hmm.
The incident rates of Black men in particular taking their own lives is massively disproportionate. Black men aren't speaking to each other. They're not talking about how they're feeling. And generally speaking, men and women, wider society, but there's some particularities within our communities because of our feeling that because of the impact of racism, our lives are meaningless. We're under pressure.
Mm-hmm.
But people don't want to talk about this. And sometimes it comes from a traditional faith-based view around committing suicide as if it's a crime. It's a sin, you don't talk about it. So the first thing to do is to say is if people are saying that they have suicidal thoughts, engage with it. It's acts of kindness, talk to them. Look at seeking professional help around that as well. But it's that stigma thing where people feel I don't want to talk about it because it might be seen as a sin, or it's a stigma that I'm even feeling this way in the first place. So people fear talking about it, and people fear responding to it. So go ahead, man. Me, I talk like that. What? Yeah. So it's that whole piece about the need to talk around that. Rosaline, you want to talk about it?
So also, people might think there's consequences to talking about it. Because when I was in the hospital and I was at my lowest, I felt suicidal. But I didn't say that to anyone because I had children to think about. I didn't want them to think I couldn't look after my children. I didn't want them to think I had a mental health problem. So I didn't talk about it. So,
That's a really good point, Rosaline. And those that have done, they find themselves detained. So we're more likely to be detained, restrained. So in the criminal justice piece, if you're exhibiting signs of mental health issues, you're more likely to be detained in certain situations under the criminal justice system. And the Mental Health Act as well is a consequence.
And to your point there, I was actually going to ask you, Rosaline, what was going through your mind at that time? Because it's going through something like that, and you had mentioned that you had to fight to keep your children. So with all of that pressure on you, of course, there's who could you possibly safely have spoken to about those feelings of suicide?
Well, at that time, there was no one. But, lucky enough, I was blessed with a priest in the hospital, and he was my savior. Because when you look external and there's no one there to help, you have to go internal. And that's what I did. I went internal. I got connected with my faith, my spirituality, and I asked to see the ward priest. And that was the person that helped me through.
I mean, Patricia made a point around that. I wonder if, Patricia, you could bring that point back in terms of the importance of, recognizing people's faith and spirituality and so forth. Patricia, you did make that point.
Yeah, Patricia's muted.
You're on mute, Patricia. You're on mute, Patricia.
Yeah, so you didn't hear me rustling in the background before. Yeah, what I wanted to get back onto, because I'm conscious that we're nearing the end, and the message that Rosaline embodies, as well as what we're all supporting her with, is a woman, a Black woman, who has charted her path to get what she needs to be resilient and to recover. And it is a journey, as you said. And I think there's some key things that are coming across to me, apart from the political statements that you say in the book and saying what everybody else needs to do. Number one, as a woman, you have to honor and recognize the messages of your body. your mind and your body. There, and I don't see there's not a difference. We try and separate, like there's one here, there's one there. It's this. Secondly, when you have had some kind of traumatic incident, that's one thing that I learned the second time around I had cancer, which was to accept the help. We're not good at accepting the help. And that means when you go for your diagnosis or you go for your thing, you take somebody with you so that they are accompanying on the journey. For instance, when I had my second time I had cancer, I had 6 weeks of radiotherapy. So 30 days. I made sure I walked with one of my children every day, either in the car or we walked. The first time around, I just carried on as normal, like I could just get over. But the second time, I thought, when this thing licked me down, you have to accept the help and let people see that you need them, not only that they should be able to rely on you. And also, when you're going through this kind of trauma about your diagnosis, you know, it's this and then it's that and then it's something else, you need a second ear because you don't always get everything down the right time. You need someone else, to, whether it's a friend or a family member or, you know, just to make sure you've got that right. You've also got to do your own homework to find out about your condition, because as David was saying, they're not giving you that information. For instance, let me give you an example. I have a medication that they want me to go on as a side effect of the current medication that I'm on. All they tell you is they say, before you take this medication, go and see the dentist. What they didn't tell you when you look down in the small print, that one of the side effects of this medication that I'm supposed to go on to counter is jawbone death. Yeah, jawbone necrosis. So that's why you're going to the dentist to make sure as far as possible that this is in order before you start taking that medication. Now, no one's explaining that to you. I had to go and look it out for myself and then go back to the doctor and say, listen, hey, I know about this. So is there anything else I can do? So unless you do your homework and follow through, you're not going to get the treatment and the care you deserve. You need to have people in your corner. It was the same for my mother. She was bipolar. You know, she had all these problematic thoughts. If there wasn't someone there to fight for her, to make sure that her pain was recognized. Again, this thing about hiding the pain, she would hide the pain when everybody was there. And as soon as one of the family or I was there, I could see it straight away. So therefore, she wasn't getting the pain relief that she needed. So all these things, you need to know your body, do your homework, take the support that you need, follow up and recognize it's a journey. It's a journey of you healing in a much more profound way than the physical symptoms actually show. And you will come through. Rosaline, I know, I can feel it. You are far more stronger, far more compassionate, and have an appreciation of beauty than before your illness. Yeah? And that's what I salute in you.
There's a point that you made, Patricia, and I know that we're coming close to time, but something that you said really struck with me. It's that whole thing of taking the support. But when I think back to culturally, how our parents and grandparents, they wouldn't go to the doctor, because I remember that's something that I would hear over and over. Oh, you know, I don't want to bother the doctor. You know, what is the doctor there for? Please go bother him. You know, so there was that part of it as well. So people not only not taking the support, not asking for the support because, oh, I don't want to bother anybody. So that culturally is how we have been. That culture, that's how I've seen in our parents' generation, our grandparents' generation. And it's now time to start really breaking those cycles of not wanting to bother the doctor. Please bother them. And like you said, I remember there was a young man that I know, he was diagnosed with mental illnesses, and his family would not take anything the doctor said unless they researched it first. Any medication, and his sister was there with a notepad the whole time, writing it down, and she was going to look it up. And that, I believe, saved that young man. But
Exactly.
Rosaline.
Sorry, I just wanted to say what you and Patricia are saying about research is very important. Because I remember when I had the tumour removed, which was the cause of my stroke, doctors were still trying to put me on warfarin, which is a blood thinning medication. And I kept asking the question, why? And all they could say is because you had a stroke. I said, yeah, but the cause of the stroke's been removed. Why are you giving this to me? So all medication was stopped from that point, just because I questioned it.
And that, you see, I think that is a powerful note to really end that on. You asked why, and once they kind of thought, actually, oh yeah, why? They stopped. Which is so bizarre when you really think about it. They just do things on autopilot without even looking at you. You literally are just the chart clipboard at the end of your bed. So thank you so much. Rosaline, I'm going to hand over to you to close us out. Patricia Lamore, I thank you. David Weaver, I thank you both so much. And Dr. Greenwood, he had to go, but Dr. Greenwood, in your absence, we thank you so much for just all of you for your advice, you educating us, and your support. Patricia, David, thank you. And Rosaline, we're going to hand over.
Thank you, Alison. Thank you, David.
I know we're running out of time, so I'm just going to give a few acknowledgements. So firstly, I'd like to acknowledge my esteemed guests, Patricia Lamore, David Weaver, and Dr. Richard Greenwood. I would like to thank my host, Alison J, for holding this event together, keeping it running on time. I'd like to thank the moderator, Jay Nelson, for keeping all the technical bits in order, and Gabriel Asante, who produced my wonderful book cover, designed it, an amazing, talented person. I want to thank my Black Sox family, a group who pulled me in a few years ago at a time when I really needed something. And I've met some wonderful people and learned a lot from them. As being part of Black Sox, I've become an activist, and I've attended coroner's inquests, I've attended meetings at the House of Commons and other events. So they've opened me up to lots of different things, and I'm still learning from them. I'd like to thank Mr. Viv Amoun, who has been providing me with professional coaching, who's helped me to manage with today's event. I'd like to thank all the friends and relatives and all the people who've made comments today. And I have no words to express to my mother and my children. There's not enough words in the English dictionary to express how much I am grateful to them and how much I love them. And I know this is corny, but I have to thank the Almighty, because without my faith and spirituality, I wouldn't be here today. So thank you all very much. If you want to get the book, it's available on Amazon, Wide Awake in a Dream. And I have a website, www.daisyrose.online. So once you've read the book, if you could go in there and leave some comments, I would be grateful to read your comments about the book. Thank you very much.
Thank you.